Good evening, everyone. Uh, Nice to have you all with us today evening. Uh, so, as usual, whenever an exam approaches, we have got a googly from the exam conducting board of some change in pattern, something happening. So this year, yes, we have got this information that there's going to be an exclusive paper for uh, medical oncology and for critical care, of course. So there is a bit of a feeling of this setting the cat amongst the pigeons, sort of where there is some concerns as to how to the medical oncology aspirants as to how to go on and tackle this change in pattern. Of course, I think the medical oncology aspirants are from two classes. There is this people from the radiation oncology background, and then the other group from the general medicine background. I believe radiation oncology people might heave a sigh of relief because they need not focus on the other branches of medicine too much now, and they can focus exclusively on oncology. Whereas the general medicine background people might have some concerns from their side. But whatever it is, whichever background you are from, at the end of the day, how you do well in a particular exam will depend upon the preparation of that exam. I really firmly believe nothing else really matters. What you did previously, which college you are from, which background, which specialty, nothing really matters. When it comes to an exam, you have got a specific syllabus to study. You need to crack it and give your best at the exam. You might have some advantages, some disadvantages, depending upon who you are and what you did. But at the end of the day, it's about doing that specific job at hand, is what I firmly believe. Uh, when it comes to medical oncology, of course, since now the focus is exclusively on medical oncology, the Bible of medical, like Harrison for general medicine, the book you always say is Devita. So Devita is that ultimate book for medical oncology, as all of you, or at least most of you, are aware. But there's something I would like to say at the start. Some students have reached out to me. I have had my friends, the juniors of my friends, who have asked me indirectly, a lot of ways, directly and indirectly, whether how much of Devita we need to cover, how much of Devita we have covered in Marrow, how much more is pending, and all of it. So, something I would like to say at the beginning is that Devita is an exhaustive book. And I'll make a very candid admission. I think none of us practicing medical oncologists are able to understand the whole of medical oncology. I've been practicing medical oncology now for almost more than 5 years. Uh, Ask my colleagues, everyone. Most of us will not be able to make sense of at least some portions of Devita because it's probably the most rapidly growing field in medicine overall. If you look at all the new articles that come in EJM, Lancet, or any international journal for that matter, the maximum number of new developments, the maximum number of new articles, research, everything is happening on college, and Devita will naturally reflect that. A lot of this, or a lot of information in Devita will sound like very technical, extremely scientific, extremely research oriented. So, as much as Devita is the Bible for medical oncology, from an exam point of view, you need to be quite smart in picking and choosing rather than trying to blindly follow the whole textbook of Devita. Uh, I have in my videos um, uh, mostly try to not go by the template of following Devita from first page to page because for a subject like oncology, that's not something that's going to really work out. I can just show a just show them show a I just saw a pop-up of what about hematology. I'll come to that later. A question from one of our users. So yeah, so coming back to my discussion, yeah. So my topics have usually been my discussions have mostly been based on this concept that you need not cover data from first page to last page, in total, because that's not really needed. As practicing oncologists, as people who have been in this field for a while, we really have an idea about which are the important topics, which are the core concepts, which are the newer developments that are coming up, which are the newer areas that are coming up. Because a lot of background research and background theory and background noise will always happen in oncology. Whereas we need to be as a teacher, as someone who is guiding you. I think our job is very clearly to separate the core things which are important, which will be asked for exams from the background noise. That's something I have strived to do in my videos going on. But that has been the approach overall as well. So having said that, since there is going to be an exclusive dedicated focus on medical oncology even for for the NEET SS pattern, uh, we are planning to add a few more segments, a few more topics. There hasn't been much focus on molecular oncology in the videos on Marrow. So there's going to be an extensive session on molecular oncology that will come up very shortly. And likewise, more topics on immunotherapy will also be added. So there's immunotherapy-oriented topics and molecular oncology-related topics will be added in the coming days, very quickly, in fact. That's number one. And number two, there has been some concerns as to whether radiation oncology questions will be asked. Again, I think this is going to be predominantly a concern of people from an MD medicine background as to how much of radiation oncology will be asked. From the extensive research that we, myself, and the team at Marrow has done, after extensive research and discussions, what we've understood is that we don't see possibility of radiation oncology questions being asked quite significantly. This is because the whole point of shifting the subject topic to medical oncology is to have a level playing field between all aspirants. So asking questions from one of the specialities does not make any sense at all. From all our sources, we have gathered that it is going to be dedicated to the medical oncology side alone. But having said that, we have decided not to take any risks. We will be having not advanced, but basic level radiation oncology topics being uploaded into the Marrow. So these are the tweaks that we plan to do. One is to have access to radiation oncology topics on our platform, which are measured, because learning the whole of radiation oncology is going to be useless. It's going to be low output, low yield. But at the same time, we should be prepared in case they decide to ask some basics of radiation oncology. We should be able to tackle. So access to that will be there very shortly. We are working on it. And then number two, we don't expect again seeing a question as to whether general medicine questions will be asked. No, hardcore general medicine questions will not be asked. Whereas on general medicine that is related to oncology, for example, infections maybe, or those kind of topics can be asked. So some of the topics are being covered in under other super specialties, but those topics will also be added under the medical oncology segment under the app as well. So these are the tweaks we plan to come up with. Some of the general medicine topics relevant to oncology, which might now be being covered under other super specialties on our app, they will be covered under the medical oncology segment as well. Number two, there will be access to radiation oncology topics that is immediately coming up. And then number three, there will be the other thing of uh, more focus on immunotherapy and molecular oncology will also be there. And this is the overall tweaks that we plan to do. Having said that, the content that is right now on Marrow is exhaustive. We have got, I think, more than 60 videos, around 1,000 MCQs. There are specific MCQ sessions based on the NEET SS pattern as well. So that NEET SS pattern, I mean INI, the INI, so the institute exam. So they are dedicated to medical oncology. So those questions you definitely have to go through. The current volume of videos on Marrow Up are already very exhaustive. They contain almost everything that you need to know to crack the examination. These additions, these tweaks in our strategy, which we have come up with since the notification came out around 7 days or 10 days back, these are the extra additions that we plan to do, which will be available very shortly. So I want you to be extremely confident because everyone who is going through this, everyone who is preparing when there is a sudden change in pattern, there will be concerns. I totally get it. There are two things to do. One is to have faith and 100% confidence in the source material that you have, which I can give an assurance for. I've tried to pick out the topics which basically, as I said earlier, I've tried to clear out the background noise from data and give you what is important. That is very much there. There will be sessions on the stuff that I just mentioned and the newer updates, the newer drug approvals, newer medicines that are approval. Those things will be available in the app shortly as well. When you look at a preparation strategy for medical oncology, even if you go by Devita, you basically have got 3 sessions to Devita. One is and then I think, the hematology. Before going into the hematology part, I have not covered the hematology part. I have not covered multiple myeloma, lymphoma, leukemia, but they have been exhaustively covered by the hematology team. So those who are preparing for medical oncology should also listen to the malignant hematology videos. The benign hematology topics like iron deficiency anemia, thalassemia, other hemolytic anemias are not going to be asked. Please don't go there and waste your time on that. Focus clearly on bone marrow transplantation questions. They might come from hematology. That too, predominantly focus on the malignant lymphoma, myeloma, leukemia, their transplant programs and their regimens, their complications, GVHD, those kind of topics. And then, of course, the hardcore malignant hematology like leukemias, lymphomas, all of those things. So try and focus exclusively on that malignant part of hematology. Leave behind the benign hematology part. They are not going to ask you that. Make sure you refer to those questions as well. So you need to go through that. The new radiation oncology questions for which you will have access. Also, all the current content that is on under that I have shot for you. So those questions you have to properly fully go through. Number 3. Number 4 will be there will be additional things that will be adding in the upcoming weeks. They'll be added pretty soon. You can watch for them and you have to go through that as well. So this much coverage of Marrow topic, I'm very sure will more than 100% equip you to crack any kind of questions that will come your way. Then coming back to what I was saying, the Devita thing, basically medical oncology, you can divide into 3 areas or 4 areas. Maybe one is hematology that I just discussed now. What you need to do, you have to go through the hematology topics, number 1. Number 2, if you look at the other parts of Devita, then there is the hardcore oncology part. There is a head and neck cancer, lung cancer, stomach cancer, colon cancer, the topic with GI cancers, chest cancers. Like that, you will have a lot of topics. That's the hardcore or solid medical oncology part. Then 3, you will have the general medicine like oncology, like the complications, the nausea, vomiting, the diarrhea, the infections. So those kind of things will be there. That will be point number 3. And then you will have the 4, which is the molecular part, the DNA level things, the molecular things, which might appear a bit Greek and Roman to some users. So these are the 4 parts of medical onco if you broadly divide it into. So how to go about tracking this one by one? Hematology, the hematology has been covered under the hematology session, the malignant hematology, number 1. Number 2, the hardcore oncology treatment-wise, section by section, they have been extensively covered as well. The CNS neoplasms will be added along with the radiation oncology segment as well, because someone had asked me about the CNS neoplasm. Will be added along with the radiation oncology segments as well. Number 2, then everything else has been detailedly covered. Number 3, then we have got that general medicine like oncology. I would say the infections, the complications, dyslipidemias, and all of it. So those topics, some of them which are already covered under other segments or other specialities, will be added under our sessions as well pretty soon. Whatever is there, the emergencies, the infections, whatever is there are more than enough. They contain all the important information, distilled information. Please go through them as well. And as I said, more advanced immunotherapy molecular stuff will be added going forward as well. Now, whether you need to read Devita, I think we as medical students are always taught or are always conditioned to go by reading textbooks. Even myself, I've been someone who has always tried to I think I've got a good question there from someone as to whether pediatric neoplasms need to be addressed. Yes, pediatric neoplasms will need to be addressed. The good news is that pediatric neoplasms are predominantly hematology. So, 90% of pediatric oncology in practice, in clinical practice, and when it comes to exams also, it's all going to be based on your leukemia. So when you cover hematology itself, a major part of your pediatric oncology is covered. But then you will have 4 or 5 major topics in pediatric oncology. They will be like retinoblastoma, Wilms tumor, hepatoblastoma, and some pediatric sarcoma. So that's it. I mean, things beyond that, things yeah, all of these topics will be grouped under the medical oncology session on the Marrow app going forward. Yes. So there's solid organ pediatric malignancies like There's blastoma, retinoblastoma, nephroblastoma, neuroblastoma, and some pediatric sarcomas. That will be it. There is not going to be the rarest of the rare types of syndromic malignancies in oncology, and you need not go there. They are very, very low yield. They do not come under the purview of a medical oncology, but a basic knowledge of the common pediatric oncology things you need to be having. Those will also be added in the marrow coming. So all these things, the extra tweaks that we have made of adding this, some pediatric onco topics, some radiation onco topics, this will all be coming under the medical onco platform of the marrow pretty soon. Even when I say all of this, please keep in mind that the core content is already out there on marrow. This uh, core content that is out there on Marrow, please make sure that you use them thoroughly. There will be 85 to 90% of questions will be from this. The remaining things, the extra additions will be added in the subsequent weeks. And then if you have got any concerns, other than that, if what I just mentioned now, if you have got any specific concerns as to some specific areas which you need me to, give short, crisp videos on for additional information or for quick reference, I just saw a message here saying whether I can do a video on catheters. That's a good one. Yeah, I'll do that. So those kind of, you have got any specific areas other than what I just already mentioned that you would like me to put up specific videos on, we will be doing that going forward as well. So to put it in short, my basic thing is what is the pattern, which background you're coming from. None of it really matters beyond a point. You have to stay confident. You have to chemo drugs. Yeah, there will be more pharmacology videos as well. Definitely, that along with this, there will be more pharmacology videos as well. So what I'm basically trying to say is that the whatever is the pattern, whatever is the thing that we are going through, what is important is to stay confident and have trust in your preparations. Uh, Thoroughly use all the MCQs and all the videos that we have on the platform currently. With the new pattern in mind, there will be a few tweaks that I just mentioned. They will come up on your app pretty soon. I'm seeing all the uh, suggestions that are coming up on my screen now. All of this will be, we are making note of that, and all of them will be incorporated, whichever we think is important. Some of the things, as I told you, some of the things are not required. They are more of humbug, more of this platitudes which really don't need our attention, this background noise things, they will be clearly distilled and the important things will be there. So have the confidence, keep going forward with this confidence in mind. With regards to whether you need to follow a textbook, I'll finish by saying that uh, we are again conditioned to go by specific textbooks. Me, myself, as I was when doing my MD medicine also, I was very hooked to reading Harrison, or when I was doing DM Medonk, I was someone who was very hooked to doing Devita. The Devita I studied is still on my rack nearby, so quite attached to that even now, if I have a doubt when I'm treating a patient, I still prefer to go back to Devita and read that topic rather than look up at an NCCN or something else. But having said that, trying to cover a book may not be a smart option when it comes to a exam like NEET. Really, you should predominantly depend upon the distilled content from it. This is especially true for oncology, where the textbook becomes very exhaustive with a lot of this background noise, where you cannot distill out what you want. And I've kind of figured that as a student who's not a medical oncologist yet, when you actually go through this topics, when you actually read through the topics, you really don't understand what is the treatment for a particular disease. Suppose you're reading CA colon, you're reading the stage 2 CA colon, for example. I think as someone who doesn't have an exposure to medical oncology, if you're trying to read that CA colon topic from data, you really don't understand anything. You will come out thinking, okay, how do I now treat CA colon? You don't get it. So basically, the simple thing that you need to know in CA colon is you have to divide CA colon into low risk and high risk. The high risk CA, I'm talking about stage 2 CA colon. So high risk stage 2 CA colon need chemotherapy. The low risk stage 2 CA colons can be kept under observation. Then those who patients who need chemotherapy, what regimen you use, how long you use. I'm giving a simple, this is the info you need. But the kind of data that will, the trial names, all the data that come under that topic will blow your mind. So from that aspect, I really don't think Devita is a bankable thing from an exam point of view. Go by the distilled information from Devita that we give you on a routine basis. The current one that's there and the updated one that's going to come up, rely on them primarily. They will cover your all your exam needs, even to be a topper. Having said that, those of you who are quite confident of it, if you want, you can pluck out, after you have covered all the course material, after you have covered everything, after you are pretty confident of all of it, maybe if you want, you can pick out a few high yield topics. I'm doing a high yield series now. I'm shooting some extra videos right now. Those high yield topics, maybe if you want, you can try to read up from Nivida, but I really don't think it's really worth your time, money, effort, and all of it. If you want to follow a textbook, I would definitely say the Harrison, the medical oncology and hematology, the malignant hematology and medical oncology in Harrison, you can go through. But again, there is not much of in-depth oncology or hematology in Harrison anyway. So that will anyway be covered in our videos as well. So my suggestion is oncology is very unique in the sense that you cannot really depend upon such a big and such a book with so much of noise. So stick to the listed information that we are giving on a regular basis. And of course, some additional reading. If you need some extra clarifications, you can please do that. And of course, you can reach out to me on a personal basis. I'll let the Marrow management share my personal email or phone number with you. You can definitely reach out to me on that platform if you've got any specific doubts as well. Uh, I think I don't have much to say beyond this. I am seeing all the questions that coming up. I think I might have missed a few while I'm talking to you. I'll definitely go through them, and whatever that appear to be quite uh, good suggestions will be taken into account. I would like to hear from you now. If you've got any specific concerns in addition to what I just mentioned, if you've got any specific things that you would like to ask me directly, not academic, of course, the academic, I mean, not subject doubts that we can do on a different platform on the preparations or the content and what we have discussed, other than what we just told already, because repeating the same things may not be, that will be a waste of time for all of you. So yeah, please go ahead. The radiation, I can again see, yeah, the questions. If you've got anyone, please. I think I've got some questions from general career guidance type questions. Um, uh, can a pediatrician practice medical oncology well? It depends on the individual. Uh, One of my close friends from my city, who is a very leading medical oncologist, is from a pediatric background, so I would have to say yes. So yeah. Uh, uh, you don't need to go through general medicine. I don't know why that doubt gotten. I think the notification is pretty clear that the questions are going to be from medical oncology. So there are not going to be questions from general medicine or radiation oncology. The questions are going to be from medical oncology, but then related general medicine that is relevant to oncology will be and should be asked. Uh, we will be whatever is not there. Some of the questions we did not, some of the things we did not add under medical oncology because they are being well covered under other topics, but they will also be added under the medical oncology section. Some of those things, but they are quite out there. Again, radiation oncology, a basic awareness, the basic level medical oncology thing will be added as well. Should we need to get updated with NCCN? No, the NCCN, I am referring at NCCN on a day-to-day basis and giving you my videos are done after consulting NCCN. The treatment part is mostly NCCN rather than Davita. So NCCN is the thing, really, if you look at it. So you don't have to separately go through NCCN. No. So I think I'm just flooded with questions. I'm not able to keep track. I think I'll go through them one by one later, or maybe you can reach out to me personally about around these questions. Some questions are of career guidance type, so yeah. So I think if you've got any question you need to raise, please go ahead and ask. We can discuss, please.
Yeah, if anybody wants to speak and ask questions, you can raise your hand and you can the your mic will be on.
Yeah, please make a video on molecular methods for investigations. It's being done pretty soon. Yeah, that's the one I just mentioned. We will be having more molecular on. Yeah.
Yeah, Dr. Bana Reddy, you have any question?
Please, doctor, go on.
Sir, have you gone through today AIMS questions? Today AIMS in SS questions.
No, I just got back from work. No, I just got back from work. I've not done anything. No.
It was a decent paper, sir. Most of the topics you have covered. I
Okay.
felt very good studying the marrow oncology from you, sir.
Sure. Sure. Good to hear. Thank you. Got any suggestions? Please go ahead. I can see a question from JR3 doing third year MD medicine. How to prepare for medical onco? So I think to balance final year MD medicine and medical onco is going to be pretty tough because final year medicine and don't need much medical oncology to clear MD medicine at all. To be frank, I had no idea of medical onco when I was doing my MD medicine. So I think that's a hard ball to balance. But of course, I mean, do your medical onco topics very well. I think hematology we can do as someone who is doing an MD medicine final year. Uh, Listen to the hematology videos, especially very well. And if you can plan out your busy schedule along with your preparation things and all of it, listen to our videos. You really can't go behind go with. I mean, even nobody needs to at this stage. And being a MD medicine person, you really need not go through our videos. Definitely,
Excuse me, sir.
please. Yeah.
Sir, can I? Yeah, sir. I've been following your videos, sir, from Medical Oncology group only. Sir, few questions I have, sir. Can you hear me, sir?
Yeah. Who's this?
Sir, I'm Shubhravati Sengupta, sir. I'm doing my radiation oncology from Medical College, Kolkata, sir.
Nice. Go ahead, please.
Yes. A few questions actually. Main first thing is that hematology thing you were saying, sir. Will that hematology topics be included in the medical oncology section? The one that the lymphoma and leukemia thing you were saying, or do I have to study it from the hematology code or SNAS's videos, sir? Can you please clarify, sir?
As of now, what I discussed with the Marrow team is that it's being done. It's staying under the hematology thing. But if somebody is having an access issue, then I think we will work on getting those videos under the. Is there an access you are not
No,
able to
sir.
access?
Sir, there's no.
Sir, I can access it.
Yeah.
Sir, I am able to access actually, but thing is that there are two sections. One is hematology separate module, and another one is Sir Rakesh Nair's videos. So Rakesh Nair's modules, those that cover lymphoma and Hodgkin and leukemia and everything. So which one should I follow then? That is my thing. Means two videos, two modules are there. One from hematology core, another from the general medicine aspect.
No, this has to be from the hematology core. Definitely. At this point, since there's an exclusive focus on medical onco, you need to be looking at the hematology core. Definitely, if you have the time, it will be more advanced, I believe.
Sir, one more thing, sir. In the general in the mm, gastro group, there are gist has been covered in gastro medicine core. Gist tumor,
Okay.
gastrointestinal stromal tumors have been covered separately. I was seeing. Will that be included also in medical oncology section?
There, if I'm right, I believe I remember shooting the recording just is already there on my video is there already.
Okay, okay, sir. Thank you, sir. Thank you, sir. Okay, sir. Thank you.
Yeah. Thank you.
Yeah, Dr. Naban, you have
Yeah.
any?
Uh, Hello, sir.
Yeah, hello.
Uh, Sir, I wanted to ask, sir, like the pattern has changed for medical oncology, but sir, has it changed for those who want to pursue DM in clinical hematology? Because, sir, some institutes offer different course in DM clinical hematology and DM medical oncology. So, like, what is the difference between the two? Like,
You are you asking me what is the difference between clinical hematology and medical oncology as two separate courses?
yes, sir. And also, sir, if the new pattern of NEET, is it only for medical oncology or it is has it changed for hematology also, sir?
It's changed only for medical oncology. Again, this is quite a technical question which I didn't really bother to
Yes,
look up because
sir,
I
I can
think that
answer this, sir. So it's only changed for medical oncology and critical care and not of the any other groups. So everything else is the same as last year.
Yeah.
Sir, what is the difference between hematology and like who will treat leukemias and lymphomas? Like if we go into medical oncology, will we treat the leukemias, or those who have done hematology will be treating those cases?
No. I mean, that's medical oncologists are trained to treat liquid malignancies. By liquid, we mean lymphomas, myelomas, and leukemias, as well as all the solid organ malignancies like breast, lung, and GI, all of it. So we will be trained as part of our course to treat both liquid and solid malignancies. So technically, yes, we can practice all of it. But then there is a trend of more medical oncologists now opting to not treat leukemias in actual practice. For practically in where I work, we have got a hematologist also in my hospital. He treats leukemias, lymphomas, and myelomas. Both of us treat, and the solid organ, of course, I treat. So there is a trend among medical oncologists in practice to avoid leukemias because they require a lot of dedicated care and all. But again, there are medical oncologists who are quite passionate about leukemia and they continue to treat as well. So that's a very personal choice. But from a student point of view, yes, you will be trained in solid and liquid alike, definitely.
Thank you, sir.
Hello.
Hello.
Yeah, hello.
Hello.
Are you
Dr. Preeti, right?
Yeah. Good evening, sir.
Good evening.
Sir, are you going to cover the oncological emergencies topics also?
Yeah, definitely. Yes, sure.
Okay. Yeah, sir. Thank you, sir.
Dr. Anil, you can ask the question now.
hello?
Hello,
Hello.
please.
Good evening, sir. Sir, MD radiation oncology students are only allowed to give paper for medical oncology only, right, sir?
Yeah.
Are they not eligible to give other specialty super
No,
specialty
they are not.
exams?
Yogesh, no, right?
No, sir. As per the prospectus, no.
No.
Eh,
Dr. Arvind, if you have any question.
Yes, as the radiation oncologist right now told, that will the pediatricians be able to do justice to the branch? So I was having a doubt regarding this, sir. Like once the pediatric background guys, like we take up medical oncology, will it be quite difficult for us in the practice, or we can really cover it up during the time of our DM course? That's my question, sir.
Sorry, I didn't. Yeah. So, see, there is going to be a learning curve for sure.
Hello.
So I think it. Hello.
Yes, I couldn't hear you well.
Yeah. Can I repeat? Is it
Yeah,
audible now?
sir, we can hear you, sir. I think it's the issue with the doctor's network.
Sure. So I think there is going to be a learning curve for sure. Graduating from pediatrics to adult, there is definitely going to be a learning curve. But then, uh, if you have done your MBBS course pretty well, your internship, and if you've done it from a good college with good exposure, you've done your house urgency pretty well, there should not be much of a problem in graduating. So I really can't comment from a personal basis because I came from an MD medicine background. What I just mentioned earlier, what I can say is that where I am from, where currently I'm practicing, one of my very close friends from another hospital is doing pretty well as a medical oncologist, managing all adult cases. He's a DNB pediatric, so and I don't think he has any issues right now. So he's doing a pretty good job. So I think people should be able to cope up as well. Yeah, and I know there are famous faculty from centers like even Adyar Cancer Institute and all. There are medical oncologists who have come from a pediatrics background. Even in my city, there is a very senior ma'am who did pediatrics. So I know people have done pretty well. So I think there is no reason if they can, there is no reason why you cannot also. So yeah.
Hi, sir.
Hi.
Actually, I wanted to know about the trial-based questions. Can we expect those questions or
No, no, no. I
not
mean,
much?
no, I mean, it's a very personal take. I personally believe trial questions will not be asked, should not be asked. And
Okay.
oncology being riddled with, I mean, you should always know the take home of the trials, the gist of the trials, what it means, what are the practice changing ones. Definitely,
Mhm.
yes. But I've deliberately not covered any trial names as such. I'll maybe when we near the exam, I'll just give a list of 10, 20 landmark trial names and which part of oncology, what was the practice changing thing that came up from it. Maybe Flora trial for osimertinib, like that. So I'll just give you a cube to grab, that sticker on the wall kind of thing towards the end, now that you ask. But I am a strong believer that should not be asked and they will not be asked. But I'll do this. I mean, since you asked, I'll do this. Yeah. But don't bother about the trials. I mean, trials always keep happening. There are 10 trials being published as we speak. You open Twitter and follow the oncology pages on Twitter, you'll see 10 new trials today. So there is no end to it. It's not human to ask you that also. It's not possible. And most of the trials, you get an approval, you get a positive trial now. 2 weeks later, someone else publishes a negative trial. So that goes off the shelf. Then you have got to wait for that. You just need to remember the practice changing stuff that come up. Don't bother about the trials. No.
Yes, sir. Thank you.
So will we be hello?
Yeah, Dr. Azim.
Sir, will we be provided a soft copy of the notes, medical oncology notes?
It's already there within the app. So there will be no PDF which will be given. Whatever is there in the app, for every video, we already have the notes within the app.
Okay, sir.
Good evening, sir.
Good evening.
Sir, will we have more tests in medical oncology? Because right now the number of tests are really less.
We're planning at least one test monthly. Yeah, we just spoke about it now. At least once a month. For sure, if you want an increased frequency, we can work on it. I mean, if a
Yes,
majority
sir,
of
please some mini tests, please, sir. It will be very good, both in hematology and medical oncology, sir.
more tests, okay. I think, yeah, we'll look into it. Sure.
Thank
Please
you,
make.
sir.
Good evening, sir.
Good evening.
Yes, sir. I'm from the medicine background, sir. My question was, can we attempt both the exams like Med Onco exam and the general NEET SS exam?
Can you? I didn't get you. Sorry. Can you?
Can we attempt both, sir? Like, can we give an exam of a NEET for all the subjects category exam and for a medical onco specialty exam? Can we give both the exams for
Oh,
NEET
okay.
SS? Both the papers, can we attempt both the papers?
Should not sure. Sorry, Yogesh from.
Sir, actually, even I'm not sure about this. So, Dr. Balaji, I
Okay.
will go through the prospectus and then I will get back to you. I have your email and phone number, so I will get back to you on this.
Okay. Okay, sir. Thank you.
Yeah. Dr. Hiren, if you have any question.
Dr. Hiran, senior, hands raised.
Hello.
Hello, please go on.
Hello. Good evening, sir. Pranav, sir.
Good evening.
Sir, as you told that from malignant hematology there will be only questions from leukemia, lymphoma, myeloma, and other things. Sir, do the platelets disorder is going to be asked from the like ITP or TTP or anything else? Sir?
But go through the polycythemia, this myelofibrotic, primary myelofibrosis, essential thrombocytosis, myelodysplastic syndromes. So they also come under
Yes,
the
sir.
malignant purview, but not ITP and von Willebrand and all those. No.
All right, sir. Thank you, sir.
Yeah.
Yeah, Dr. Sakshi, you can ask your question.
Yes, sir. Good evening, sir. Sir, you have uploaded the soft copy notes for all the videos, but not for Ewing sarcoma and the first video of head and neck cancers. So, would you upload the soft copy notes for them as well?
Yeah, I think those two videos are missed. They will be uploaded by tomorrow itself.
Okay.
Yeah.
Don't have any further questions?
Yeah, so I think they're just repeats. I think you have answered almost all the questions, sir. And if anybody has any more question, I'm just dropping in an email. You can just mail it to us and we'll get back to you on that.
Yeah. I hope we have answered most of your concerns. I'm happy to have received some very interesting feedbacks and your concerns as well, which will be added in the upcoming videos and upcoming sessions in a phased manner rather than having it all out there. we will be giving them in a phased manner as well. Some of these suggestions regarding last minute revision topics regarding trials and drugs and side effects, they'll be very seriously taken as well. They'll be included as well. But overall, don't panic with the sudden change in sudden change in preparation. Those who are very focused on medical oncology, stay focused on medical onco. Go through the approach to each cancer that is very more than in detail dealt with in our videos. Uh, and also the radiation oncology subjects, some pediatric onco subjects that will come up, go through them. They'll be at a more basic level, but have an idea about them as well. The general medicine oriented medical onco subjects will come up as well very soon. They're already on the app. They'll be consolidated into a list, and then the suggestions that I got from you guys, as well as the things that we have planned, like more molecular oncology, immunotherapy kind of stuff, they will also be pretty soon available. Meanwhile, whatever is there on the app is very sufficient to cater to all your needs currently. Make sure you stick to your plans. Make sure that you have got solid plans and that you stick to them. Uh, this changes in pattern is going to affect everyone at some point. We have all gone through this as various stages. I think, if I'm right, I think we were amongst the first NEET SS batches myself when that changed. So I think we have all gone through changes in patterns and all of it. At the end of the day, as I told you, there is a job to do. There is a specific thing to be covered, and those who do it in a systematic and a brave manner, dedicated manner, will come out on top. So have that faith. Uh, Anything else, if they've dropped the pin there, you're also free to have my number too. If there is anything that you need to reach out to me going forward, also we can work on it. Having a separate WhatsApp group for MedDonco is something I saw. We can work on that as well. No issues. Great to have you all with me. Looking forward to seeing you all later on as well. All the best. Thank you.
Yeah. Thank you so much for the session, sir. And thank you everybody for joining in. You can always write to us if you have any more question at support@marrowmet.com. Thank you.